A blanket of toxic smog. India's capital is suffocating with dangerous levels of pollution. And people in New Delhi are being warned it could make them more vulnerable to COVID-19. So, what can be done to avoid a disaster? This is Inside Story. Hello, welcome to the programme. I'm Bernard Smith. The air quality in India's capital is amongst the world's worst. In winter, pollution in New Delhi soars, making it extremely difficult to breathe. The air becomes still and a thick cloud of smog settles over the city. It's full of pollutants from vehicles, construction, industry and crop burning, to name a few. These lead to eye and nose infections and lung diseases. And on top of that, there's the coronavirus, which makes respiratory illnesses potentially deadly. The quality of air in New Delhi deteriorated dramatically nearly 2 weeks ago. It reached 490 on a scale of 500. A score between 0 and 50 is what the World Health Organization considers safe to breathe. But on November 10th, air particle pollutants briefly surged to 30 times the safe limit. The number of people complaining of respiratory diseases in New Delhi was reported to have risen. Doctors say 13% of the city's recent COVID-19 cases may be linked to air pollution. Many of New Delhi's residents have complained of breathing difficulties on days when pollution levels soar.
We face trouble breathing as well as mild headaches more than usual. As the winter is settling in, along with the rise in pollution, our heads hurt even more. It is absolutely impossible to go out and about without masks because of the pollution.
I have diabetes and hypertension. The double blow of COVID-19 and pollution has affected me a lot. I wasn't stepping outside my home because of the bad air, and the lack of physical activity made my diabetes get worse.
Pollution is posing a lot of troubles. I run daily. After running on the road, I feel the impact on my lungs. It feels heavy. I bought this protection mask for that, but the pollution is so bad that this mask can't provide adequate protection from polluted air.
We wear a mask, the level of oxygen becomes low, and if we don't wear a mask, we face problems. There is pollution. Though it got slightly better after the rain, it is still there.
New Delhi is battling both toxic air and a record surge in coronavirus infections. It's seen more new cases than any other Indian state. More than 7,000 people a day are developing COVID-19. The number of beds available with ventilators is shrinking. The government has flown doctors in from other regions and expanded testing. But there are still major concerns over the ability of New Delhi's healthcare system to handle the crisis. Let's bring in the guests. They're all in New Delhi. We have Deepa Sinha, an assistant professor of economics at Ambedkar University in Delhi, Dr. Sarika Verma, an ear, nose and throat surgeon, and Karthik Ganeshan is a research fellow at the Council on Energy, Environment and Water. Welcome to each of you. Karthik, I'll start with you, if I may. This pollution appears every autumn. It's not new. Why is it still happening, and why is it getting worse?
I think it's happening every year primarily because this is when the winter sets in, and so it's as much a meteorological phenomenon as it is a man-made phenomenon. And all it says is basically that this pollution exists all year round. It just manifests itself in such a worse manner in the winters. So the vehicular pollution, the dependence on private vehicles, right, the management of solid waste in the city-state of Delhi, right, the incessant burning of waste that happens because it's not collected and disposed of in an appropriate manner, and construction dust and debris, all of these big sources of pollution, which don't get addressed year-round, and it just comes up, in a much bigger way. And I think, the episodic incidences of crop burning and Diwali firecrackers, all of these just add to it. So I think they're a distraction for the policymaker, honestly, because they focus their attention inordinately on attending to those, for the few weeks and the days for which those exist. But then the moment that dies down, everybody feels that we've gone back down to levels which are acceptable. And then for the rest of the year, nothing happens. No news channels cover it either, unfortunately. And in November next year or in October next year, we'll again all be up in arms. So I think it's basically because the attention is there only for a very short period on the issue, but we're not addressing it in a holistic manner throughout the year.
Deepa, is that what happens? People kick up a fuss for the few weeks that the pollution's there, and then they forget about it and forget to address the root concerns?
Absolutely, I completely agree. If you look at the causes for the pollution, much of those are systemic. We can't do anything about the meteorological issues, but we all know that come autumn, this is how it's going to be. And there are so many things in terms of both behavioral changes as well as institutional structures, which need to be done in a much more consolidated manner and a sustainable manner continuously to address the pollution. And we don't see that happening. So what we see is that those who can afford it we get our purifiers out as the season changes, while others suffer. But overall, it's something that's become quite predictable. But still, unfortunately, one thinks of it, the city and the governments and generally the public seem to be thinking about it only when the season comes.
Sarika, I imagine this must be one of the busiest times of the year for you. Can you just explain what the most severe consequences of this pollution are on patients that you deal with?
Pollution is a problem throughout the year in cities like Delhi and Gurgaon. Of course, it becomes much worse in winter, but we are seeing this cyclically year on year from September to February. So it is very distressing to note that at a time when we also have patients with the pandemic, the COVID-19, which has locked down everybody, and the added pollution makes it much worse. You have respiratory distress in all my allergy patients. For the last month and a half, I have been prescribing medications preemptively because we know fully well that in November, the allergies will become much worse. The pollution levels will go beyond control. And we are also advising children and patients with respiratory distress to start taking the nebulizers early.
Okay,
So this twin-demic, the air pollution and pandemic is creating a havoc in patients with respiratory diseases.
Okay, thank you. And Karthik, many Indian cities top the global list of the most polluted. New Delhi's there at the top of the list. Why is New Delhi particularly more susceptible to this level of pollution than other parts of the country, even though there is pollution elsewhere? What's special about New Delhi?
Right. I think it's the geography, of course, is a very big part of it. It's just that, it sits adjacent to like a really big dust bowl, right? Which means that there is always a constant influx of dust coming in from the desert and from perhaps even from Central Asia that adds to the ambient levels generally, right? But in addition, this is a metropolis that's been growing, in an uncontrolled manner for the last 3 or 4 decades now. And as a result of that, it's, I guess, and it doesn't have any abating influences of a coast, right? Which, let's say, a Mumbai or a Chennai or a Kolkata have. As a result, the pollution basically stays, and we don't get this effect of meteorology, which, with the temperature inversion and all of that, in other parts of the country where the population density is so much. And added to that, the dependence on private vehicles, for instance, in Delhi is phenomenal. There is, of course, a lot of public transport available. The metro is great. The bus system is reasonably good. But the number of people using cars to get around is just, it's outstanding. So all of that, of course, adds to it. And I think the bigger problem really is that the city administration, the state's administration, and the central administration are 3 different bodies that basically control it. And there's just no coordination among them to actually make things better, right? So some roads are under some administration, some roads under others. So because of this lack of coordination, it's like, oh, you handle it. And as a result, nobody's handling it. And that's one of the reasons why we have, I think, a plethora of issues that the city faces.
Deepa, Karthik mentions there the bureaucratic problems. India has got a central pollution control board and there are state pollution control boards. How effective are they at trying to manage pollution in India's states?
Well, currently the pollution control boards don't really have that much teeth, and they are not well placed to do this kind of coordination among states on policy issues. To give an example, one of the external factors in this season is the stubble burning, which happens in the neighboring state of Punjab. So the agricultural policy there has to change, and the Punjab government has to reach out to its farmers to use alternative technology. That is something that the Pollution Control Board currently is not empowered to address. There is a talk, and recently we had an ordinance passing, setting up a new commission which is supposed to look into all of this. But once again, this happened only last month after the pollution began. So we do need better institutions to address these issues. Currently, we don't have them existing, along with building infrastructure in terms of public transport and so on, and public awareness as well. Currently, the institutions that we have are not equipped to handle.
Sarika, of course, on top of all of this, we now have the coronavirus. How is the pollution making life harder for people who are suffering from coronavirus? Is it making things worse?
See, COVID-19 affects the respiratory system directly and reduces the oxygen saturation even in the best of times. When you have the pollution increasing to such levels, respiratory distress increases. And so even patients who were earlier getting better with home quarantine and home isolation are now needing beds with oxygen. And that is why our hospitals are struggling to keep beds available for every patient. Almost every patient has a respiratory issue, and for when the oxygen starts dropping, everyone needs high oxygen beds, and that is already stretching the existing very thin infrastructure to breaking point. And now even today I was struggling to get a couple of people admitted, so it's a very difficult time right now.
Do you see any light at the end of the tunnel? Doctor, is this going to get worse, do you think?
We will, of course, and the entire world is struggling. Fortunately, India has lower mortality. It's 1.5% compared to US and Europe, probably because of genetic reasons or probably because the population has been exposed to different kinds of viruses earlier on. And that is hopefully our saving grace, because most patients, more than 95% patients, are recovering at home. Having said that, pollution needs to be tackled so that the air quality gets better. You must be aware that infant deaths, air pollution causes about 1.26 lakh deaths per annum. So for a disease, when the COVID-19 happened and the entire world stopped, we have had about 1.02 lakh deaths in India. For a disease that is causing deaths every year on year, our government obviously is not taking it very seriously, and I would like it to be declared as an air emergency.
Okay, Karthik, Deepa referred earlier on to stubble burning as one of the reasons in neighbouring states, Punjab and Haryana. Again, that has been known about for a long time. They're burning stubble from the rice paddies and straw from the rice paddies. Why hasn't the government been able to tackle that?
So we work closely with the farmers in Punjab on this matter, and I think the primary challenge is that this generation of farmers that's currently there is so used to this cycle of rice and wheat that for them to think of shifting away to something else, right, requires systemic changes, right from the procurement options for alternative crop that they might sow, to training regarding how do you go about cropping other crops, the watering patterns, the resources required. All of that needs to start from scratch, because the government actually spent a lot of time and money getting them to grow rice in the first place. Initially, they were actually reluctant. You're talking about through the 80s, right? And now, given that so much effort and money has gone into actually getting them on board to cultivate rice, I think equal amount of effort needs to go into sort of unlearning all of that and telling them that, well, this is not sustainable from many aspects. The most important of which is the water availability in the state of Punjab, which is precipitously declining with every passing year. And in the interest of long-term agricultural prospects for the state, I think the farmers will have to adapt to growing something else, but that is not going to happen with strict diktats like, I will fine you if you burn. It has to happen with hand-holding, with these agricultural extensions, as they're called, schools, so to say, for farmers to go and learn and for them to get resources, and to staff them and to give them resources to train farmers. If that doesn't happen, and if the government doesn't procure, or if there aren't market mechanisms to procure the crops they otherwise would cultivate, this is probably going to go on for a while until it just becomes unsustainable in many other ways to just grow rice in Punjab, which would be a sad state of affairs.
Karthik, can you quickly though help us understand why this process of burning off has endured. The government's tried to get farmers to find other methods to clear the fields, and I know there's a tight reseeding period between harvests. Just help us understand why that's a problem.
Right. I mean, the solutions that have been developed are homegrown. That's the beauty of it, right? Which is, there's this, these happy seeder, and then there are these other technologies that helps, incorporate the rice residue in the soil. But the thing is that all of these are, implements one on top of the other. Punjab is already one of the most heavily mechanized agricultural states and perhaps regions in the world, right? The per capita ownership of things like, or per acre of harvesters and of tractors probably rivals Europe and America, which means that, adding more and more implements makes it very expensive prospect for farmers to actually continue doing it. And they're already under serious levels of debt. So there have to be models that are sustainable in terms of whether it's leasing, whether it's community purchase and use, right? And then, of course, the education part of it. As I said, it's happened in 4 years, but every year, unfortunately, we've kind of gone with the stick in September of each year saying, do this or you'll get fined, do this or you'll get fined. And the political will to sort of really implement that fine is not there, and it's unfair, really, right, to actually ask them to pay a fine because nothing's been done throughout the year. So I think unless we can actually put money where the mouth is and do something about it. And I think in the long run, the better solution is to, not even the long run, I'm talking about even the medium term, to get them away is probably the solution. And I think it's happening increasingly when the conversations that we're seeing, because a lot of people are saying that the cost of agriculture is already going up significantly in Punjab. And maybe it'll just come to it that, farmers just shift en masse as opposed to, trying to sort of solve the rice residue issue itself.
Deepa, the government does have a national plan. It launched in 2019 to cut pollution by 20 to 30% by 2014. How realistic does that target look now?
So like all the issues that Karthik just talked about and what we have been discussing, we don't see any actual movement on the ground on any of this. So if we think that if things continue the way they are, then those targets don't seem very realistic. I think the very important point is to understand that this pollution is not a one-time event, that this is something that needs a change in many, many things, like the agricultural policy. So it cannot be that in these months we find the farmers and then the rest of the year things go on as usual, like building public infrastructure, public transport, separation of waste, reduction of solid waste, all of this, and we don't see any of that really happening. And all this cannot be put only on individuals and on just public advertisement kind of campaigns, but all of this needs structural support. So it needs a lot of investment to come in from the government also. We must remember that it is a country which has a huge number of people who are below the poverty line and the high levels of inequality. And therefore, unless there is support in terms of infrastructure and various other systems, these things won't work. And in that context, if it's business as usual, then I'm not very hopeful.
So, Rika, what is the effect on recovering patients of pollution? I mean, are you telling people to get out of New Delhi if they're recovering, or what happens to people?
Recovery rates are obviously COVID in the polluted air reduces the recovery by almost 50%. And we have already seen that patients who are recovering from COVID develop pulmonary fibrosis and they have respiratory difficulties and fatigue, even 6 to 8 weeks after they are RT-PCR negative. So when you have polluted air, it just makes it much worse. And with all the festivities that have happened, people have been out and about without masks. They are causing the pollution is just an added burden on the existing problems. And unless the government is serious about tackling pollution, not just with plans, but with actual actions, we are going to be very, very difficult times ahead.
Karthik, in China, the government there is aggressively promoting now greener vehicles. Of course, in China, there's a much more top-down control over the development of the state's economy. But China seems to have seen the future for greener industries. Why hasn't India yet?
So I think Delhi's got a fantastic policy, by the way, for electric vehicles, if that's the sort of tip of the iceberg in any case. But all of those are going to come in maybe, in about 5 to 10 years, right? For 5 to 10 years, all of those changes are incrementally going to impact, each year, maybe, 5% or whatever it might be. So I don't think it's relying on just those, right? Those industries to come in and replace is likely the solution at all. But that's it. India still needs to do it. And I think there's a whole suite of policies that if you've been looking at the announcements from the finance ministry, right? The performance-linked incentives for, industrial manufacturing, particularly, those that represent green industry is there. Of course, India has been slow to get on that bus, primarily because, we don't have the fundamental industrial manufacturing backbone that China has had for now, at least 3 or 4 decades. And unless we sort of build that up, and decrease our own reliance on China, even for simple components, right, specifically in the electronics industry, we will, of course, find it a challenge. But I think the government is serious about it, primarily because it understands that jobs in India rely on these industries actually coming in, and that's really the future. And automotive, specifically, since you talked about cars, is one of India's biggest exporters, and as well as, a big contributor to overall GDP in the country as well. So they are definitely, serious about it. But, that is not going to solve the problem for another 10 years at least, because the stock of vehicles that we have and the continuous sales of, petrol and diesel vehicles that already, are there will probably, continue well into this decade itself. So I don't think we should rely on that to solve the problem, but it's something that I think is being addressed.
Deepa, you seem to have suggested in some of your earlier answers that there has been a failure by the government to grasp the seriousness of pollution. Do you think the government grasps the importance of a green future, of greener technologies?
See, I think in the rhetoric, it's all there. And there is definitely much more acknowledgement of environmental issues now than there was even, say, about 4 or 5 years back. And we do see many of these coming in. But at the same time, I would reiterate the point that one of the issues is that each of this is still looked at in different silos, and we have to see the link. So the agriculture policy, the nutrition policy, the employment policy, all of this has to become green, along with being pro-poor and, like we used to say, engendered. So it also needs to be looked at from an environmental lens now. So I think it needs a much bigger change in the public space, in the way we think about what economic progress means and what is the kind of future that we see for ourselves. And within that, green technology plays one role, is one component. So all of this is coming in piecemeal manner, which is positive. It's better than not having anything. But at the same time, I think the bigger picture is something that we are missing.
And Sarika, can I just ask you, in terms of, I know you're not an economist, but clearly the amount of ill people you are dealing with, these are people who could be working and who should be working. Do you end up telling people to take a lot of time off work because of the respiratory diseases they're suffering from?
The cost of staying at home and looking after a sick child or a sick parent runs in billions of dollars. Unfortunately, in India, we don't have data, but the economic cost of poor health is huge. If the government can have a mindset as to understand the larger picture, a healthy nation is going to create a lot healthier economy. The way China has tackled air pollution is something that India can definitely learn from. Beijing at one time used to shut down because of bad air quality, and I think Delhi is already there. Right now, like both Karthik and Deepa have said, we have the plans in place, we have the words in place, but we don't have the action to go with those plans. We have to start stopping thermal plants. Like Germany has already stopped its last coal-powered power plant in 2020. And India is even now starting new power plants based on thermal energy. So we have to walk the talk. We have to create urban forests. We have to do a lot more than we're actually doing if we expect a healthier population. And I would also like to add that the health budget needs to go up really high because the current healthcare is mostly provided by the private sector, and the government needs to invest in that as well. It's very difficult times, but this is also a great time for actual change to happen at the policy level, when the entire world has stepped back to review its situation. It's a great time for India to start making massive changes in their policy that every action should be a sustainable development so that we can have a healthier population and we don't remain in the same position next year.
OK. Thank you very much for that. We are unfortunately out of time, folks, but thanks to all of our guests, to Deepa Sinha, to Dr. Sarika Verma and Karthik Ganashan, and thank you too for watching. You can see the programme again anytime by visiting our website, aljazeera.com. And for more debate, you can go to our Facebook page. That's facebook.com/AJ Inside Story. You can also join the conversation on Twitter. We are at AJ Inside Story, and I am at Jazeera. From me, Bernard Smith, and the whole team here, bye.